I'm discussing the potential of the gut microbiome in the treatment of Alzheimer's disease. My name is Travis Nguyen. I'm in 11th grade. So Alzheimer's is known for its progressive cognitive decline and memory loss, and it's caused to severe impairment in day-to-day functions, which could eventually result into death. I'm identifying the gut microbiome and its role and how it could potentially reverse engineer the tract. So the gut microbiome is referred to the trillions of microbes that live in the GI tract, and when it's imbalanced, it leads to potential neurodiseases like Alzheimer's. My objective in this research is to determine whether or not the gut microbiome could lead to a potential cure to Alzheimer's. For this paper, I researched and analyzed several other relevant primary studies, but a limitation of my research is that it's a new field that's being researched, so there isn't that much information available. And a few theories that relate to my topic is stem cell therapy and the modulating of neuroinflammation. So, as I said, this research is a secondary literature review, and all my data is based off multiple primary studies and articles. And the philosophy derives from the sole fact that the gut microbiome is a factor in the cause of Alzheimer's due to imbalance, and scientists hypothesize if there were a way to reverse engineer the process. And my conclusion is that recent research suggests that the gut microbiome may influence brain health, could potentially help reverse the effects of Alzheimer's. Specifically, in one study, they studied the chronic supplementation of milk enriched with bifidum, which improved memory in some patients with Alzheimer's. In another study, they researched the strain of Bifidobacterium brief, and it turned out it improved the cognitive function in some individuals with impaired memory. And in another study, they researched the exact same probiotics. It showed to help change the gut microbiome composition and increase concentration of anti-inflammatory. My research experiences, I would just like to thank Dr. Varke and Dr. Virgil for helping me write this research paper. And I specifically liked the one-on-ones that were available to me and how interactive the class sessions were. That's it.
Wonderful.
Good job, Travis. I know that this is like also a very broad topic in some sense. So, have you tried to look into whether Alzheimer's, when you say that the gut dysbiosis is linked to Alzheimer's, do you think that once Alzheimer's is set in, does changing the gut, dysbiosis, does it help? Or gut microbiome, does it help?
Could you repeat that one more time for me, please?
So does changing the gut microbiome after the individual already has Alzheimer's, does it make any difference to the patient?
Yes, it does, because Alzheimer's derives from the fact that the gut microbiome composition is imbalanced. So therefore, by implementing probiotics and trying to change the gut microbiome, it does affect the disease.
Okay, so Travis, that's that's a good answer, but partially correct, because once Alzheimer's is set in the brain, it cannot be healed completely, even by changing the gut dysbiosis, because Alzheimer's eventually, in Alzheimer's, there are some particular peptides such as A, beta, and tau, which affect, or they act like a prion, like protein, causing transmission of the aggregated proteins within the brain. But if the gut dysbiosis is taken care of prior to setting in of Alzheimer's, then it can be very helpful. So maybe you can look a little bit more deeper into this, because it's a chronic inflammation of the brain caused by gut dysbiosis that eventually results in Alzheimer's in certain cases. So maybe like you can also look little bit more deeper into the dive, much more deeper into this. And best wishes for your future as well.
Thank you.
Excellent work, Travis.